Okay, hi. So we have our beautiful patient Jocelyn that we have posted before that she got treatment for TMS, transcranial magnetic stimulation for depression and anxiety. She comes back for follow-up, and she wants to share some experience about TMS with us and tell us how she's doing now after finishing the whole course, which was how many days?
37?
37 days without weekends. Every day she would come and get the treatment, and we did both sides of the brain, right and left, this side for depression, this side for anxiety, generalized anxiety disorder, and she is feeling much better. But I want you to hear it from her so she can tell about her experience, what she feels, what's going on, what changes it made in her life, and which is really amazing. Okay.
So I guess because you do it every day, it gets you into a routine of getting up, which when you have depression, it's really difficult. So the first week, I had to force myself to get up and come here, but I made a promise to her that I was going to stick with it. And by the second week, I was looking forward to coming here and getting my brain zapped. But it doesn't, you can feel it, but it's not, it's kind of like a rubber band snapping your skin without the sting at the end. So that's what it feels like to your brain, or to your head at least. And then as far as like emotionally, I feel, well, first of all, I recognize days that I'm depressed. It's not that I'm not depressed, because I'm gonna get depressed, but I can recognize that I'm depressed instead of always being depressed and not knowing it, because I'm just always, that's like status quo for me. So the fact that that I can recognize it is like completely amazing to me, because I don't think I've ever recognized that I was depressed before, or that I was going into like a more sad time. Yeah.
Deep depression. How long you've had depression before this?
Oh, I couldn't tell you.
Long time.
Oh, I'm 53. I've been going to therapists my whole life. Yeah.
Okay. And you have tried different medication, yeah?
Everything. I mean, I think the only medication I haven't tried is Wellbutrin. But I've tried like antidepressants, and the antidepressants didn't make me not depressed. They just made me not care that I was
indifferent. Yeah. So, but since then, now you finished. What are you doing that has changed your life? What's the results of this, you think?
Well, we're starting the Manjaro, so I'm losing weight. I've lost 18 pounds so far, and I'm averaging about 0.52 pounds a day. And I'm going out. I went to the beach with my daughter yesterday and was walking around, which is like amazing, because you know. Oh, I've been going to the gym and doing the aqua aerobics, because I have lumbar issues too, but which is why I came to see
you. Which you take care of that too, by the way. We take care of her back too.
Taking care of.
Yeah.
Which also, I mean, the pain goes into depression too, so that's why this helps like really let me recognize what's going on. But it also, it's changed just my feelings. It's allowed me to feel, instead of like just always just not caring about things. And it's really amazing that the difference between what I was when I first came here and what I am now. And I'm starting to tear, and I'm sorry, because when Dr. Heidari first met me, I was sitting in her office just sobbing, and she was just asking me questions, and I was just sobbing, and she had asked me, or we were talking, and I was talking about those same things just recently, and I stopped sobbing. I'm not sobbing over them anymore.
It's happiness sobbing.
It's now I'm happy. Exactly. They're happy tears. So.
Me too. I'm so happy for you. So it's so rewarding to see that it's life changing for my patient, and it's just amazing. So seeing her now is interested from someone who didn't want to get up and move. Now she goes to gym, she goes to beach, she makes cupcakes and bring it to us, which is the best thing. And she's a very good baker. So, and she's happy. I just seeing her that she is in the path to the healthy life. Now she's losing weight, and she wants to come and help us actually with TMS. And she wants to promote it to patients who are depressed and anxious, or have OCD or insomnia. That helps. So we want to help people. That's our mission here, and whoever needs help, we would be happy to help them. Yeah, so we are a team that is going to help, and she's going to be actually one of our promoters and help us with everything. So she is expert now.
I have to say, if you have any questions whatsoever on whether this will help you or not, all I can say is that it helped me. And I would suggest that you try it. Try it for 2 weeks, because I guarantee you after those 2 weeks, instead of it being a have to come, it'll be like, I can't wait to get up in the morning and come and do this. And once you leave, there were times where I would fall asleep with it zapping my brain. Which you would think, if it's hurting you, that you wouldn't fall asleep to it. But it's really not hurting you. There's times where I fell asleep. But there's also times where it was like almost euphoric.
Yeah.
So the feelings of it, just correcting what needs to be corrected. It's on this side, it was fast, because those depression neurons needed to learn how to speed up. I used to call it boot camp for my brain, because they had to learn how to function correctly.
To get more excited.
Exactly.
The neurons needs to be more excited on that side for excitatory.
Exactly. And the anxiety side, they needed to slow down some and figure it out and just be calm. And so I find that these neurons are slower now, and they're more calm, and these neurons are
there is a balance now. This side was hypoactive, now is more active. This side is hyperactive, causing anxiety, insomnia. Now that is low active, because the setting of the after brain mapping is very different. So yeah, I'm so happy that you're doing so well. I really thank you. And are you willing, if anyone has question, to message you or something?
Absolutely.
So are you? Yeah. So she will be happy to share her. I don't know what is better for you, Instagram or something. We can tag you. If any question, ask Jocelyn. She's the pro.
Yeah, send me a DM. I'd be happy to talk to you and answer any questions you have.
Yeah, that's awesome. We love you. She's our bestie, because we saw her every day for 36 days, back to back. No, miss her. We want her to come in and say hi and bring some cupcakes. Okay. Thank you.